Your larynx is sometimes called your voice box, and like many other parts of your body, a viral infection can cause inflammation in your voice box, in other words, laryngitis. Now this will usually result in having a husky or croaky voice, or you could lose your voice completely and end up whispering. You may have a fever, you may have a sore throat, a cough and cold and so on. It usually gets worse for sort of 2 or 3 days, and it's usually completely settled in a week or so. However, there are certain situations where you should see a doctor. If your symptoms are very, very severe, and especially if you have shortness of breath, if your fever hasn't settled down in a few days, if your hoarseness lasts more than 3 weeks, especially if you're a smoker, if you have swollen glands which last for more than 2 or 3 weeks after you first get the laryngitis, if you have swollen glands without symptoms of infection, if you have symptoms in your neck like a lump which isn't a swollen gland, or if you're prone to serious infections. So for instance, if your immune system's weakened, so you could be on chemotherapy or you could have other serious medical conditions. Treatment though is usually symptom relief. Fluids, paracetamol, maybe humidified air, and don't talk too much. It should settle down, but do watch out for those warning symptoms that mean you should seek medical help.